and welcome to Health Matters. I'm Dr. Jack Jolwitz, a board-certified dermatologist and skin cancer specialist. I'm also your host. This is a very important show because we have as our guest Dr. Ken Zaid, and he will teach you how to save someone's life today. We're talking about sudden death. Each year in America, over 300,000 people die suddenly. Most don't even know they are sick. Dr. Zaid will introduce you to the AED device and show you how and when to use it. So the next time you witness a sudden death event, you'll be prepared to save a life. Dr. Zaid, welcome to Health Matters.
Well, thank you for having me.
Sure thing. Why don't you tell us about your training and where you practice and what type of practice you have?
Okay, well, I'm a cardiologist. I'm also a board-certified electrophysiologist, so I specialize in the heart's electrical system and disorders of the heart, specifically arrhythmias. I've been in Bradenton for 2 years, and I work at Bradenton Cardiology Center.
Well, again, welcome to the show. And as I introduced, this is about sudden death. So why don't you start with a definition of sudden death and how big a problem it really is in America?
Well, sudden cardiac arrest is when someone collapses suddenly and there's no spontaneous return of circulation. So that is to say, they don't faint and then come back to. They actually would die if there's no intervention done, such as defibrillation. This is a very big problem. It's a pandemic. In industrialized countries, it represents more than 15% of all deaths. And in the United States alone, it represents 450,000 deaths a year.
So my estimate of 300,000 was low.
Low, but it's difficult to tell actually because there might be an overcall because if someone dies without forewarning, it's attributed often to sudden cardiac death.
So the electrical system in the heart is what keeps the heart beating regularly, and that's what keeps your blood pressure up and
Right.
you awake. And when there's a disruption in the electrical system, that's when you collapse.
That's one of the major causes. Now, there are other causes, and one thing that we need to differentiate is between a heart attack and sudden cardiac arrest. And it's difficult, and it's difficult for the community to really grab their teeth into this. So even the Heart Rhythm Society, which is our major organization, has a campaign, and they want to make sure that people know the difference between the apples and the oranges. Because myocardial infarction, a heart attack, is a cause of sudden cardiac death, but most often isn't the only one. And most often, heart attacks don't cause sudden death, although they are a contributor. Sudden death could happen from heart attacks, but most often from an electrical disorder of the heart.
So electrical disorder is different than a heart attack,
Yes.
although there's some overlap because a heart attack can cause an electrical disorder.
Yes.
And this is your specialty.
Yeah, and it is complicated.
Okay. Well, I'm glad that you understand it. Now, the electrical rhythm, when it becomes abnormal, that's what we're talking about when somebody can have a sudden death event, the irregular electrical signal in the heart.
So there's a number of things that can cause sudden death, and one thing that we're going to get into a little bit later is with these automated external defibrillators, they really treat one type of problem, and that is when the heart rate is going too fast. It might be a little counterintuitive. You say, well, the heart's going fast. I thought sudden death is when the heart stops. It's actually not the case.
But the heart going too fast doesn't allow it time to fill up with blood,
Exactly.
so the blood doesn't pump correctly.
The heart's an electrical pump, and like any pump, it has to be primed.
I see.
And so you need time for the blood to fill in the chamber to then be expelled to get to the brain and allowing it to stay upright.
So that's the most common cause of sudden death is with the electrical system not being in sync with the heart.
Exactly. The electrical system is doing its own thing. It's often going too fast. but that's not the only cause.
I guess sudden death can occur to anyone at any time by
Yes.
definition.
Right.
So are there risk factors that when you're talking to a patient, you can identify risk factors that may lead you to think there is a suspect for a sudden death event?
Yeah. I think that the most important thing is when you look in an individual person, you want to break them down in terms of their risk. You want to see how old they are. That's a pretty easy dichotomy to have. The people who are younger than 35 often can get into, and you see this oftentimes on the news where an athlete unfortunately will die suddenly, and it happens too often. Those problems that those people have primarily are structural problems with the heart that they're born with, and that can be a problem with maybe too much heart muscle, maybe an irregularity of the way that the heart cells the electricity within the heart cells flows. And the way to screen that is by taking a family history, just talking to the patient.
So a good history
Yes.
in someone who's doing a lot of athletics and sports or new to sports
Right.
is the most important part of that screening.
And especially in the under 35 category, what you really want to do is you want to make sure that they haven't passed out. They haven't felt like they were going to pass out. They haven't had palpitations. They haven't had a family history of someone who died suddenly, especially someone who's died suddenly in a car crash that they can't explain by alcohol, someone with a drowning, and then there's some more esoteric things such as congenital deafness. So really there's a lot of different things that you ask for, but mostly what you want to know is when you do exercise, what happens to you? Do you nearly pass out? Because nearly passing out may be a shot over the bow.
A sign that something else can happen
and
if
that it
you
would
push it.
Exactly, it would just continue.
And the older person?
The older person's a different story most of the time. Most of the time, the older person will have coronary artery disease. So they have blockages in their heart.
Whether they know it or not.
Right, and so unfortunately, sometimes sudden cardiac arrest is the first sign of coronary disease, and that's a tough draw.
So
combat.
the risk factors to be concerned of is diabetes and smoking.
Yes.
And being overweight.
Yeah, and actually those first two are so important, because in medicine, right, what can we do? We can try to help people feel better, we can try to help them live longer. We can't control everything, in our lives. We can't control our genetics, we can't control, our age and our gender, but we can control the food we eat, we can control smoking, and we can control cholesterol. So those are the things that we have at our disposal that we're pretty good at intervening upon. So you have to catch it early.
It's important that people know their risk factors in that regard.
Oh, for sure.
So they can reduce their own risk of sudden death.
Right.
What is a typical scenario if one were to witness a sudden death event?
Well, the person usually collapses. They may feel just a little bit funny, and then they
just
pass
fall
out.
down.
Right.
So right in front of you, you may be standing, walking, sitting, someone will just collapse.
Yeah, that's what happens.
And what are you supposed to do if you witness this event?
Well, it's always helpful to have some sort of training. Now, not everyone is going to, so I would say the first thing is if you have any interest at all in this, then you should try to look into it a little bit more, maybe take a Red Cross class. But let's say you haven't done any of that yet. You haven't had time to get trained. The first thing, the most important thing is to call 911 because the emergency medical services are excellent. They're prompt, they know exactly what to do, they're very efficient, and they save lives. Once you know that you've called them, well, now everything that you do to help that person is just a bonus, and the earlier that you can intervene upon helping someone out, the better.
So the first step would be start CPR, check for the airway, the breathing, the pulse,
right?
And
exactly.
Start cardiac compression.
And in fact, even early defibrillation is more important than rescue breathing and compressions. The most important thing is actually to find an AED if you have one and put it on. In the meantime, before an AED arrives, Hopefully, you're not the only one in this situation, but if you are, before an AED arrives, you can do CPR, but the most important thing is as soon as that AED arrives, use it.
You mentioned defibrillation.
Right.
This is an AED, and this would be the case, and these are in airports. The policemen often have them in their cars, they're in malls, they're in workplaces.
And anywhere where there's a lot of people. And in fact, it's funny, you know.
And what does AED stand for?
Oh, automated external defibrillator.
So this is an automated device,
Yes.
and it will save someone's life.
Right, and I think that's an important point because it will do everything that it needs to be done.
So anybody can do this.
It's made for the lay public. And in fact, I've never used one because I've only used the ones in the hospital.
So you're going to, let me introduce our third guest that's kind of lying here. This is Matt, and as you see, Matt has collapsed just before our eyes, and he happens to have an outline of a human figure. And Ken,
All right.
save his life.
All right, well, this is a true trial run here. So he's down, and obviously we've already looked to see if there's any airway obstruction. We've already felt for a pulse.
And we've called 911.
We've already called 911, and that's really the most important interventions. But now you have the benefit of an AED.
So this device, it says pull, so you open that up.
Well, I'm going to turn it on first.
Begin by removing all clothing from the patient's chest.
This is actually an important point. So it's an important point that you can't worry about modesty in this circumstance. You can't worry about, you know, oftentimes we hear of people worrying about patients having.
Cover and take out white adhesive pads.
We worry about people having a pacemaker or women wearing bras. You have to expose the skin. You have to cut the clothes. You don't worry about this.
As a matter of fact, it comes with a scissor that we can remove the clothing with.
And take out white adhesive pads. When patient's chest is bare,
okay, so let's see what we do here.
Protective cover and take out white adhesive pads.
Okay.
All right, well, here we go. So they each have.
Look carefully at the pictures on the white adhesive pads.
So this is
Peel
actually
one pad from the yellow plastic liner.
This is telling us, it's all right.
Okay.
Look carefully at the pictures on the white adhesive pads. Peel one pad from the yellow plastic liner.
You just do it.
Okay, so this is the one that looks like that goes
shown in the picture.
Right here.
Press firmly to patient's bare skin.
So this is a no-brainer. This
When
is
the first pad is in place,
telling you
no
what to
one
do.
should touch the patient. Analyzing.
So now it is checking the heart
No
rhythm.
one should touch the patient.
right,
Analyzing.
and it just is looking
Shock
for one of those
advised.
rhythms.
Stay clear of patient. Press the flashing orange button now.
Okay, so we make sure that we're both clear.
Deliver shock
And then we
now.
press
shock
that
delivered.
button, and that's it. And then it just is going to look again
Be
for the rhythm.
sure emergency medical services have been called. It is safe to touch the patient. Begin CPR. For help with CPR, press the flashing blue button.
Let's hold off on that for now. So when you applied these pads, first it tells you to look at the pictures on the pad.
Yes.
And it's very clear to me that
1 minute,
one goes
45
on the
seconds
chest
until analysis will resume.
and one goes on the abdomen. And you put them on, it analyzes automatically.
Yeah.
And in this case, it determined a
30
shock was
seconds
necessary
until
and it
analysis will
delivered a
resume.
shock. And it told you to push the button, stand clear and push the button.
Right.
So you don't need to be a cardiologist to do this.
No, it doesn't even allow you to see what the rhythms are, which is a little bit frustrating from my professional capacity. But that's really all that matters. You know, is the rhythm shockable or is it not? And if it's not shockable, it won't shock. And there's really no risk to the person who's fallen. There's no risk to the rescuer.
1 minute until analysis will resume.
Well, why don't you push that blue button again and
It
see
is
if
safe to touch the patient.
we can get another scenario.
It is safe to touch the patient.
Okay, so
I think you have to hit the green
45
button.
seconds until analysis will resume.
Okay.
Okay. Well, you saved his life. He collapsed in front of you. All you did was take this out of the container that
Yes.
was sitting on the wall, and you listened to the verbal instructions that the device is telling you how to do this. You put the pads on in the correct place.
Right.
Anybody can do this.
It's made for the public. It's not made for trained medical professionals.
It seems too easy.
Well, I think that the main obstacles, of course, are just making sure that there are enough of these in public places and making sure that people are comfortable doing this.
To know what they are and what
Right.
they're for. Now, in this scenario, in this training scenario, it delivered a shock to the patient.
Yes.
Does it always deliver a shock to the patient?
It shouldn't. No. I mean, if there are only a couple of rhythms that are shockable. Now, fortunately, those are most of the rhythms that we find in this setting. But if the patient, for instance...
The ones that require a shock,
Yes.
that would restart their heart correctly,
Yes.
so they could get up again.
Yeah.
And it's that simple.
Yes.
And the ones that do not require a shock are more
Well,
onerous?
so the yeah, it's a little bit more difficult to treat those patients, obviously, and they may require the types of services that the EMTs, that the emergency medical technicians and emergency medical services can provide, and you're not expected to do that as a lay rescuer. Really, the benefit of these types of machines are that they restart the heart promptly. And
put it back into a normal sinus rhythm.
put them back
to
into
sustain life.
hopefully whatever rhythm they were in previously.
I think these are ingenious machines, and I don't know why they aren't more of them. Now, somebody who has an irregular rhythm that goes into a bad arrhythmia,
Right.
these things are implanted in them.
Right. So let's just say that Matt survives, and unfortunately the odds are against him. So the odds of sudden cardiac arrest victims surviving to hospital discharge is pretty poor.
Is that because there aren't enough of these around and treatment isn't instituted fast enough?
Yes. Yes.
It's that simple.
It's that simple. There are very clear studies that show that the earlier that somebody can get defibrillated, the better their life expectancy, and the longer it takes, the worse life expectancy. It's a linear relationship. But let's assume that Matt is one of the lucky ones, because it only took us a couple minutes to defibrillate him, and he comes to regular. He comes to a normal state. That is to say, he's back to himself. Well, then he would be a sudden cardiac arrest victim who survived, and we would implant an internal cardioverter defibrillator. Now, these are commonly known as defibrillators. They're about the size of a hockey puck almost, a little bit smaller, of course, and they're usually implanted in the left chest and connected.
And they work
with
the
wires.
same way. If they
The same
detect a
way.
rhythm, it's basically a hands-off thing.
Exactly.
They detect an abnormal rhythm, they fix
Exactly.
it. And too many people die when it's that simple to save their life,
Yes.
and it's just a shame. Well, Ken, I'm impressed because we just saved Matt's life with that automatic external defibrillator. And unfortunately, I see Matt just collapsed again right before our eyes. So let's see
All right.
if we can save him again and pull another trick out of the hat.
Begin
All right, well-
by removing all clothing from the patient's chest. Cut clothing. Look carefully at the pictures on the white adhesive pads.
So all I've done is
Peel one pad from the yellow plastic liner.
just taken I've just pulled the door open
Place
and
pad exactly as shown in the picture.
placing
Press
the pad
firmly
exactly
to
as it
patient's
shows in the
bare
picture.
skin.
and this doesn't take very long. Of course,
When the
if it actually
first
happened,
pad
it would
is
seem
in place,
like it was taking a lot longer.
Look carefully. No one should touch the patient. Analyzing.
That's pretty simple.
Yeah.
I mean, now we just,
No one should touch the
we're
patient.
not doing
Shock
CPR, we're not
advised.
breathing, we're not pressing.
Be sure emergency medical services have been called.
This
It
is-
is safe to touch the patient.
This
If
is-
needed, begin CPR. For help with CPR, press the flashing blue button.
So I think what we talked over it, but it said that shock was not advised. And so,
So it analyzed the rhythm this time,
right.
and it's decided not to shock it.
Right, and I think that what that underscores is that there's more than just malignant ventricular
1 minute,
arrhythmias
45 seconds until analysis will resume.
that can cause this problem. And specifically, someone could have a diabetic coma. Somebody could have taken drugs. Somebody, there are innumerable causes
There are
of
hundreds of causes for someone to collapse.
to collapse
Could
that are
be-
not due to something that this would treat. But the important thing is that a great majority do involve something that an automated external defibrillator can fix.
Well, the important take-home message that I see here is that this is so straightforward. Anybody and everybody should be able to do this.
Yeah, it's really just a yes or no question, and
And you don't have to do anything. You just have to put the two pads on the right place, and the pictures are straightforward. And
exactly.
well, I'm impressed that the technology has come so far to make this type of event, this life-saving event, so simple. And I'm glad that you shared this with us today.
Well,
And,
thank you for having me. I think that it's really important that, number one, that we teach the public how to use this, to feel comfortable with this, to just live for that moment, because you could potentially be that person's hero, and also to do your best personally to try to avoid being Matt and take care of yourself, and make sure that your symptoms, that you don't just blow off symptoms such as passing out, nearly passing out, a family history of recurrent problems like this, and really make sure that you talk to your doctor about this.
Well, you need to be attuned, of course, to your body and to understand what the messages are telling you, and learn how to use this, because you never know who you might be saving. It may be one of your own.
Right.
Well, everybody, now we know what these automatic external defibrillators are for and what they do. You see them at the airports, at the schools, malls, workplaces, stadiums. The police have them all in their cars, so they're often available. These are devices that are here for you to use. That's right, for you to use if you witness a sudden death event. 300,000 plus people die each year from sudden death. Learn first aid, learn CPR. Now you can apply the AED, the automatic external defibrillator, just by following the simple verbal instructions that the machine tells us. I want to thank cardiologist Dr. Ken Zaid for sharing his knowledge with us today and teaching us how to use the AED and demonstrating it and saving Matt. It was a brilliant maneuver. If
Thank
you
for having
have
me.
risk factors that we discussed today, please see your doctor to improve your health and lessen your risk of sudden death. On behalf of my guest, METV, I'm Dr. Jack Jowitz, reminding you to wear your seatbelts and your sunscreen because your health matters to me, and thank you for watching.